again, where every single week we want to give you tips on how you can decrease your pain, improve your function, and also your longevity. We have Rocky here again today with me, and today we're doing episode two.
Mm-hmm.
And
Episode
we're going to
two.
go over some stuff about our office, right? Rocky, you looked on the internet to figure out some topics that you think people would have the best things or some things that people would like to ask a lot. What kind
Mm-hmm.
of topics have you come up with today?
Well, basically, number one is the diagnostics.
Uh-huh.
Another topic that I have is the services or uh, the services that we offer in the clinic. And then, the final one is the tip of the day. So
Okay. Fantastic, fantastic. So
those,
we're going to try to do this under about 5 minutes here. That
yep,
way we keep the video nice and short and sweet.
will
So
do.
some of the diagnostics that we have in the office is digital x-rays and ultrasound.
Hmm.
Because whenever someone has had a injury, you really want to find out what their problems are on the inside. I will never work on someone who's had trauma without knowing exactly what is going on inside their body.
Hmm.
So if you've had trauma, don't expect to come in and just get a quick fix, right? Because you probably don't want a quick fix. Quick fixes are probably how a lot of people got to where they are. So we don't want to do that. And in ultrasound, a lot of our injections are ultrasound guided so that we know exactly where the needles go and when it's being done.
Hmm. Right. Of course, we don't want to, we want to make sure that we get the root cause of the problem.
Yeah,
Um,
yeah, no guessing.
yep. And do you treat just, neck and lower back problems?
Um, so we treat mainly the whole body, right? You got the neck, the lower back, the shoulders, your arms, hands, fingers. We've done adjustments and injections on all of those. To mid lower back, you got your hips, ankles, your knees, your feet. So we work on all of that. Now, of course, the number one problem that we treat is sciatica and lower back. Most of the people that go to the hospital's emergency reason why they miss work is due to sciatica and lower back problems. So it's not that we love treating, we're just really, really good at it,
Mm-hmm.
but because that's one of the most prevalent problems out there.
Right. Okay, what about sports injuries?
Oh yeah, we work with sports injuries all the time because a lot of the patients that come to us is they've gone through their sports. They've played basketball, hiking, had falls, whatnot. So they themselves go through a lot of injuries, and we treat that as well.
All right,
Don't mind
perfect.
me, I'm gonna put my Swanwick glasses on to really filter out some blue light here.
Okay, all right. And speaking of sports injuries, do we also do, nutritional consultations?
Yeah, we work with people's nutrition, understanding that what you put into the body and what you will get out of it is very, very important, right?
Mm-hmm.
You are what you eat. It's that is quite true.
Mm-hmm.
So if you're not paying attention to the foods that you eat, ultimately, then you're going to be eating foods that aren't going to pay a lot of attention to you,
Mm-hmm.
and your body will break down faster, have a lot more inflammation, and overall more arthritis, and lead to a lot more autoimmune problems.
Of course. All right. And what about kids' injuries?
Kids injuries.
Mm-hmm.
I mean, kids get hurt all the time. Nowadays, with sports, they play so much sports and they compete at such a high level.
Mm-hmm.
We take care of a lot of kids here ourselves. Teenagers, my daughter gets adjusted. She's 9.5. And we have some teen, players that play pro football, hockey, some sports, right?
Mm-hmm.
They are wanting to go into college,
Mm-hmm.
playing sports on sports scholarships. And the reason why we see them is because we've got to keep their bodies healthy. A lot of their parents never had the opportunity to do that, and they want to make sure their kids do.
Okay, right. What about emergency cases?
Emergencies is not one of those things that we treat. Not a lot of people come to our office for emergency reasons. Of course, maybe someone pulled their back and then their back went out on them. Yeah, we
Mm-hmm.
can treat those type of problems. But in general, people usually come to us because they've already been through certain chronic pain. It's gotten worse.
Mm-hmm.
So that's what we mainly have to focus on.
Of course. All right. Okay. So those are all of the questions that I have so far, Dr. Tim.
Okay.
I guess let's go to the tip of the day. So,
Yeah.
what is your advice for those people who are working at home and staying in front of their computer for
Mm.
6 or 8 hours sitting down? What are your advices?
Right. So we've made a video, I can't believe it was last year or the year before, on how to sit when you are in front of a computer, right?
Hmm.
Ergonomics is so, so, so important. So we make sure that people have their ergonomics set up correctly, desk, chair, keyboard, mouse is all in the right place. And make sure every 30 minutes to 45 minutes, get up and move around for a couple of minutes
Hmm.
to make sure you stay moving throughout the day. So you're not just sitting, all the time.
Hmm. All right. So
Yeah,
maybe we can go through, probable stretches in the future
absolutely.
topics. All
Hey,
right.
I'm all about that. I can do stretches, we can show different things. So
Mhm.
I think we want to just make sure that we provide value to a lot of patients because a lot of people out there, they hear drugs, surgery, cortisone shots, right? They hear these things, but they don't really hear about how do I correct these problems if
Mhm.
I don't want just heavy doses of medical intervention, right? And that's what we provide in our office.
All right. Okay. Great, great information, Dr. Tam. So I guess that's about it for today.
Okay,
Let's stay tuned
fantastic.
to the episode 3.
Episode 3. All right,
Yep.
Rocky, thank you so much.
Thank you.